Now we are going to see the classification of mental disorders. Only we are going to see the classification of mental disorders, not about the disease conditions and its details. There are three classifications. The first one is ICD-10 classification, International Statistical Classification of Disease and Related Health Problems. Another one is DSM-4, Diagnostic and Statistical Manual. Actually now DSM-5 also available. Next is Indian classification. So there are three major classifications we are going to see. First you see ICD-10 classification. This is the classification of WHO for all diseases and related problems. This is classification of WHO for all diseases and related health problems, not only psychiatry. But psychiatry also there. That is its meaning. But psychiatry where it placed inside this classification is in the chapter F. The chapter F they have separated like this: F002, F09, F102, F19, F22, F29, like that F99. Like this F full chapter they have classified 1, 2, 3, 4, 5, 6, 7, 8, 9. So 11 categories they made. Under that each category is having the different types of mental disorders. So the chapter F classifies psychiatric disorders as mental and behavioral disorders and codes them on an alphanumeric system from 0 F alpha numeric 00. So in this system they made to categorize all mental disorders. Okay, that is alphanumeric system matlab means F00 to F99. Okay, so F00 to F9. In this all organic including symptomatic mental disorders are coming. So how they classified, you see, this is organic including symptomatic mental disorders. In this you see F00 dementia, F01 vascular dementia. So under this also some classification, F01.1 multi-infrared dementia. So like this F001, F1, F2, F03, F04, F05, like this F09 unspecified organic symptomatic mental disorders. So like that F0 to F9 they classified the organic mental disorders. Another one is F10 to F9 mental and behavioral disorder due to psychoactive substance use. Psychoactive substance using alcohol one chapter, opioids one chapter, cannabinoids one, sedative hypnosis, like this all substance abuse products based on substance abuse products they have categorized from F10 to F19. Then schizophrenia, schizotypal and delusional disorders. So this is you see some major classification they have given: schizophrenia, schizotypal, delusional. These type of disorders comes under this F22, F29. Then mood disorder, this manic episode, bipolar. These are some major, especially most of them knows depression and mania and bipolar. So here depression, mania and its subtypes. So everything comes under this F32, F39. And neurotic stress related disorder. Here phobia, obsessive compulsive, somatoform, these type of disorders are coming. And F40 to F49 neurotic stress related, that we have seen now. And F50 to F59, this is behavioral syndromes associated with physical disturbance and physical factors. If there is any physical disturbance based on that some abnormal psychiatric behaviors exhibited by patients, then based on that we can tell. So in this eating disorders, so eating disorders it is related to physical disturbance. If they are fat, they will eat more food and they will try to vomit because they want to maintain or reduce their weight or size of their body. So based on that, then sexual dysfunction, sleep disorders, this all comes under this behavioral syndromes associated with physiological disturbances and physical factors. And another F60 to F69 disorders of adult personality and behavior. Adult personality and behavior, that is specific personality disorder, impulsive disorder, gender identity disorder, paraphilia, sexual disorders, and these type of disorders comes under this adult personality disorders. Then 72 79, F72 F79 mental retardation. This is a mild mental retardation, moderate mental, severe mental retardation, profound. This main disorders are seen in mental retardation. F80 to F89 disorders of psychological development. Psychological development, attention deficit hyper. These are childhood disorders comes under here. And behavioral and emotional disorders with onset usually occurring in childhood and adolescence. Some other types, okay, that we have seen. Then unspecified here, unspecified. There is some disorders not mentioned in above or not comes under this above categories that will comes under unspecified mental disorders. So in this way, the ICD-10 classifications related to mental disorders are there. So next we can see the DSM-4. DSM-4, they class their factors. There are different axes are there. Their chapters we said F chapter was for mental disorders. Here, the mental disorders is classified based on axis 1, axis 2, axis 3, axis 4, axis 5. Like this, they classified. Under this, they have mentioned so many different types of disorders. This is there I said this is ICD is based on WHO classification. This DSM is based on American Psychiatric Association. American Psychiatric Association. So I said DSM 5 also came. So you see the DSM 5, the multi-axial system has been removed. In DSM 5, this axis multi-axial. This is we are telling multi-axial system. Axis 1, axis 2. This method they have removed, and instead they made chapters. There are 20 chapters. They are explaining all the categories of psychotic mental disorders. In the 20 chapters. By 20 chapters they are mentioned. So this is about DSM-5. So DSM-5, DSM-5 and DSM-4. DSM-4 before that it was with the axis system. Now it is chapter system. That's all. Next we are going to see Indian classification. Indian classification, they classified mainly all mental disorders comes under three categories. They made it under three categories. So one is psychosis, another one is neurosis, and one is special disorders. If you are seeing in psychosis, again they are classifying into three. That is functional, affective, and organic. So in functional, some diseases are coming. That is schizophrenia. Under schizophrenia, heavy feeling, simple, catatonic, paranoia, and so many other things are there. But here four mentioned. In affective, if you are seeing a mania, depression. In organic, if you are seeing acute, chronic, organic disorders comes under this. Then this under psychosis. Then neurosis, if you are telling anxiety neurosis, depressive neurosis, hysterical, obsessive compulsive, phobia neurosis. Okay, so like that it is there. Then special disorders. In special disorders, they made five different classifications. One is childhood disorder, another one is personality disorder, and substance abuse, and psychophysiological disorder, and mental retardation. Childhood disorders, conduct disorder, and emotional disorders. This is a few disorders they mentioned here. I mentioned here. And personal disorder, sociopath, psychopath, and substance abuse, alcohol abuse, and drug abuse. Psychophysiological disorder, asthma, psoriasis. These disorders commonly happen due to the psychological abnormality. Mental retardation, mild, moderate, severe, profound. So in ICD-10 also we have seen this type of disorders. According to India, they made special disorders. Under special disorders, in that mental retardation is there. Under mental retardation is mild, moderate, severe, profound classifications are coming. So like this, at different places, the major categories are there. The about detailing about all the disorder one by one we can see in next videos. Thank you.